Welcome to the Learning Lab. My name is Roman Garcia. Today we're going to change the subject matter a little bit. We're going to talk about probably the most common reason why people visit their doctor, which is low back pain. These last few volumes we've been talking about knee issues, and in the future we'll have a lot more to talk about as it relates to knee issues. But today we're going to talk about low back conditions. And what I'm going to show you is one of the primary mechanisms of what causes degenerative changes in the low back. Now, there are many ways that you can hurt your back, but in these modern times that we live in, where we're involved with a lot of sitting, watching television, at work, and so forth, this is probably one of the more common mechanisms of injuries to your low back. But before we get into the gist of the subject matter, I want to first show you some simple physiological mechanisms of the mechanisms involved in this type of low back injury. Now, in order for a low back to function properly, the disc, which is the material that's in between the vertebrae of the low back, the disc has to be relatively well hydrated. Now, the disc, I described it here. This is a vertebrae. Let's say this is lumbar vertebrae number 4. This is lumbar vertebrae number 5. In between is a disc. Now, a normal functioning disc, which is this right here, will have what is referred to as a negative pressure inside of it. All that means is that this material right here has potential space that can be filled by something. In this environment, that something is basically water molecules. Now, since there is a negative pressure or a space that can be filled inside this disc, this negative pressure attracts water. Now, if you notice these lines right over here, these arrows, this longer line right over here, this represents the negative pressure. You can see that this arrow is longer than this arrow right here on the bottom. This smaller arrow represents positive pressure. Positive pressure is what's outside of the disc material, outside of its environment. Now, since the arrow, the negative pressure, is larger than the positive pressure, which is on the outside, this potential space, this negative pressure, attracts water from its environment, which comes from out here. So as long as a disc is functioning in this negative state, it stays well hydrated and its volume, the integrity, is maintained. This is what you want for the rest of your life. You want a disc that's in a negative state. Now, a degenerative spine or a degenerative condition is one where the negative and positive pressures are reversed. There will be positive pressure on the inside of the disc and negative pressure on the outside. Because there's positive pressure inside the disc material, the water molecules, the space is none. The water molecules are all escaping the inside of the disc itself. Again, this is the 4th lumbar vertebrae. This is the 5th. You can see that this arrow represents the positive pressure, and this arrow right here represents the negative pressure. There's negative pressure now on the outside and positive pressure on the inside. So the water molecules are being pushed out. There is no space inside this material, so it can't absorb any water because there is a pressure inside the disc that's forcing everything out. Now, Carlos, you can come to me. Now, there are several reasons why this could happen, but today I'm going to show you one of the more common mechanisms that creates this type of environment. Now, before I get to that, I want to give you just a simple description of a term that's very important for you to understand. A normal spine will have a C-shape type of curvature. This type of shape, this pattern medical term for it is lordosis. This is what you would like to see of your x-rays if ever a lumbar x-ray is ever done. You want to see this C-shaped pattern, because this C-shaped pattern affords the disc the proper environment to maintain that negative pressure inside, versus a spine that looks like this, very straight. This is basically, simple terms, it's a straight spine. It's a flattening of the lordotic curvature. A flat back syndrome, basically you can also call it. If they ever take a lateral view of your lumbar spine and your spine does not have this lordotic or this C-shaped curve, and it's straight like this, then you know that you are not in a negative state of disc, but you are in a positive state. This straight pattern will have a compressive, will create a compressive element onto your disc, thus creating positive pressure inside your disc. The potential space of the lumbar disc is reduced. So all your water molecules, everything that makes up a hydrated disc, it's all being expelled into the environment out here. And Carlos, you can come to me now. And if this condition continues, then as time goes by, then you'll start experiencing reduction of disc volume. Now, what I want to do now is, now you may ask, okay, now what can I do? How can I get this diagnosed? The answer to that is very simple. You just simply have an x-ray done. An x-ray is the easiest way to do it. You just have a x-ray done laterally, and you'll be able to appreciate the type of curvature that you have in your lumbar spine. It can also be diagnosed through a physical examination, which I'm going to show you now with my assistant, Ana. Ana, I'm going to show you how that examination would look like. Now, it's not easy to be able to diagnose a flattening of the lumbar spine through a physical examination. It takes an examiner many years of experience and tactile perception, real acute tactile perception, to be able to appreciate a lumbar level that has lost its normal curvature. Now, I've done this for many years, so I can easily experience or diagnose a loss of lumbar curvature. Now, I'm gonna show you a really quick examination of how that is done. Now, Carlos, you can come over here so people can appreciate this curvature right here. Now, it's as easy as this. Running your finger down the lumbar spine. After you've done this a few million times, you'll start to appreciate when a lumbar level is stressed. Because when a vertebrae gets stressed, it hypertrophies. It actually gets larger. So it will protrude through the skin, and you'll be able to palpate it. You'll be able to feel it. When the lumbar spine completely has lost its curvature, you will not. I don't know if you can appreciate this back home, but maybe if I do this right here, you'll appreciate it. You see this convexity right here. A spine that has lost its curvature. You see, Ana has a nice lordosis. She has this C-shape pattern to her lumbar spine. I can palpate it, and with this line, you can see it. She has this convexity. It's a scalloping. I can feel it, and the line, you can visually appreciate it better. Ana has a nice curvature. That tells me that her lumbar discs are relatively healthy. They're well hydrated, because as long as that lumbar disc is hydrated, it will preserve this curvature. When they start experiencing loss of tissue volume, or the disc starts to become dehydrated, it loses its plasticity, its pliability. So the spine, naturally, because of the muscle tensioning and the way that the soft tissue pulls on the spine, it will pull the spine out of that lumbar curvature. Now, what I'm going to do now is I'm going to show you some examples via x-rays of that curvature and lack of curvature. The first one I'm going to show you is a spine that has the curvature. This is by all means not a perfect spine, but it does have the curvature, and you can see it right here. You can see it's C-shaped. Because of that, you can see it's C-shaped. This is where the disc is right here. This is the disc right here. You can see there is some degenerative disc disease here. This lumbar curvature is still relatively preserved. You can see the disc material. It still exists. It's starting to be compromised, and you can start seeing some loss of curvature up here, especially in this upper lumbar levels right here. This is number 5. This is 5. This is 4. This is 3. This is 2. This is 1. Number 1, number 2, and number 3, you can see that they're really, it's straighter. You can see the line is straight, whereas here you still have some curvature. So this person is on their way to developing that straight flat back syndrome. They're not there yet, but it's working towards that. Now, I'm going to show you now a spine that's completely in a flat back syndrome. And you can see the stress, again, the disc material over here. There's still disc here. This is number 1. This is number 2. This is number 3. This is number 4. This is number 5. Now, a lumbar curvature can be lost and still have preservation of the disc if the individual has musculature that is in a spastic condition where they have strained it. The muscle tightens and will pull the spine out of its proper curvature. Now, you can be in this position for a short period of time, but if you exist in this position for years at a time, these discs will start experiencing loss of their hydration. In a little while, I'm going to show you an experiment where you can appreciate the disc, how it hydrates from water. Now, this is a spine of a professional bodybuilder. This individual was in his late 60s, still physically looked very well, but you can see that his back was absolutely no disc material here whatsoever. This is number 5. You can barely appreciate it. This is number 4 lumbar vertebrae, number 3 lumbar vertebrae, number 2 lumbar vertebrae, and number 1 lumbar vertebrae. The discs are right here. All you have is a small remnants of what used to be disc. This individual has been and was in a straightening flat back syndrome for years before he started to experience lumbar issues. He was existing in this position from his exercise routines. Now, Brisa, te puedes sentar. Te puedes sentar. Now, Carlos. Now, this I'm going to show you. What I did here is I created a model of a lumbar spine. This is number, I don't know if you can appreciate this. This is number, let's say that this is number 1 lumbar vertebrae. This is number 2 lumbar vertebrae. This is number 3 lumbar vertebrae. This is number 4 lumbar vertebrae. And this is number 5 lumbar vertebrae. These colored objects right here, these represents the disc. These are normal disc right here. These purple ones are the normal disc. This green one is the abnormal disc. You can see how narrow the size is different from these healthier ones. This represents a disc that's in a degenerative state. This is what would happen if your lumbar spine straightens like this and you're operating under this mechanism, because all the weight-bearing load, most of the weight-bearing loads are always concentrated on these lower ones. So this disc represents the disc between number 4 and number 5. Now a disc, as we saw earlier in these diagrams, operates simply like this. And I'm going to give you an example. Now, this is basically, this is water. This is simply water. Now, appreciate what happens to this green structure right here. Let's say that the spine, now as I inject the water, you can appreciate how it starts to expand. See how it's starting to expand? That's basically how the disc operates when it's in a negative state. It's able to absorb water. It's able to absorb water. You can see it's expanded. That's how the disc operates. But it will only operate in this negative state as long as it's able to maintain a resting curvature, lumbar lordosis. The moment that it assumes a straight spine, a flat back spine, such as this, that disc will get compressed, and you can see the water rolling off my fingers. This is exactly how it operates inside the body. If it persists in this position, the fluid will leave the disc material. And that's what happens. As long as the spine retains and goes back to its lumbar curvature, it will absorb the water again from its environment, as you saw earlier. And that's basically how the disc operates. Now here at the Learning Lab, we always like to bring products to the people who watch our videos. Superior products at superior prices. Now, I've been working recently with some Parkinson's patients, and I came to the story of a man named John Pepper. John Pepper is an individual. He still exists. He lives in South Africa. John Pepper was diagnosed with Parkinson's disease, and he wrote a book. The book is called, Carlos, if you can focus in here, it's called Reverse Parkinson's Disease. John Pepper is the author. Now, I wrote this, I read the book. The book gives an account of John Pepper's experience with Parkinson's disease and how he was able to overcome his Parkinson's disease. I heard of this man through an associate of mine, and I did research on him, and I saw that I got to know that he wrote this book. So I went on to Amazon to acquire the book because I wanted to read. I was very interested about a man who claimed to have been able to beat the disease Parkinson's. And Parkinson's disease, if you're not familiar with Parkinson's disease, is a devastating neurodegenerative disease. I believe it's the second most common neurodegenerative disease in the United States and maybe even the world. It's a devastating disease, not only for those who get afflicted by it, but also the caregivers. So I was very interested in what this man had to say. There are many Parkinson's books out in the public domain, but very few, if any, written by a Parkinson's sufferer. So I went to Amazon to acquire the book, and as a matter of fact, I did acquire the book. But I acquired it. I was surprised about how expensive this book is. I paid $153 for this book. I think that at $153, it was worth every penny for what Mr. Pepper says about his disease and about how he was able to beat the disease. Now, I'm going to show you these price points on Amazon. Carlos, if you can see it. Basically, this is the price that I paid for it. I paid $160 for it. It was fulfilled by Amazon. I've bought many expensive books in my time, and this is one of the more expensive books that I've ever paid. And I know I've never ever minded paying a lot for a book, because I believe that information is the key element that individuals can use to combat any disease that may afflict them. So you can see here the book, Reverse Parkinson's Disease, and it's by John Pepper. And these are the price points. These are the more cheaper price points. $160, $167, $190, $183, $200, $250, $252, $270, $288. You get the point. It's a very expensive book. Courtney can come to me. It's a very expensive book. Like I said, at the price that I paid, $160, I didn't mind paying it because of the information that's inside this book. But what I wanted to do is I wanted to get the book and I wanted to share it with some of my Parkinson's patients. So what I did is I did a search. I tried to see if there was any way that I can get this book for cheaper than what Amazon has it on their sites. And we all know that Amazon is one of the more cheaper sites that you can buy any product. So when I did my search, I was able to find a mechanism to acquire this book. And I highly suggest anybody, if you are seeing this video and you have a loved one, if you are taking care of a Parkinson's patient, if you know somebody that's just been diagnosed with Parkinson's disease, I highly recommend that you acquire this book and you give it to that person or you give it to that caregiver, because apparently there are ways that you can deal with Parkinson's disease that's not being shared by the neurologists who are diagnosing these people. And John Pepper has done this, and he's clearly explained it in this book. So what I did is I acquired this book, and because of the great price that I was able to get it, I'm able to pass on this savings to anybody who's interested in acquiring and owning this book and reading this book. I can get you this book for $30 plus shipping. Is that inexpensive? $30 plus shipping. Depending where you are, the shipping cost for one book cannot be that much. Now, if you're interested in acquiring this book, do not go through Amazon. Contact me. We always give our contact numbers on this video. It is a great book, and at $30, it's a lot cheaper than these $200 average price points that you're seeing, and the only way that you can get it. I cannot explain why this book is so expensive on Amazon. It just is. But I found a loophole in the system where I can bring you this book for $30. As easy as $30, as little as $30 plus shipping. So again, if you see this video and you're interested in acquiring the book, or if you're interested and you have a comment to say about this particular subject matter, or if you live in South Florida and you have low back pain and you really want to know whether you are in this negative or positive state of your lumbar spine, please contact me, because I do operate out of South Florida, and this is an examination that needs to be done physically. Okay, so so for anybody who's seen this video, again, you know, we always bring these videos and we bring these products, and we always try to bring you the best prices possible for every product that we have on our videos. For anybody who sees this video, I want to thank you. Until next time.